Next presentation is titled Facing Dementia Together, Strengthening Families and Protecting Brain Health, and this is led by Michelle Bradley. So Michelle is a memory care navigator with Sun Health, and they are based in the city of Surprise. She brings over 30 years of experience in healthcare, social services, and counseling. She holds a doctorate in health administration, a master's in counseling, and a bachelor's degree in social welfare. She also brings her personal experience to her work, having cared for both of her parents who had Alzheimer's or have Alzheimer's. Her presentation blends professional expertise with lived experience to guide families with empathy and practical support. And so now, Michelle, I'm going to turn it over to you to get started on this presentation.
Thank you. We practiced this beforehand and it didn't look like this. So give me a second. It looks like it's sharing it through my Teams instead of from my desktop. And I'm looking to see if there's a way to do it.
We can see your screen, and if you're happy with how that looks.
Okay, I'm just going to go with it for the sake of time. How's that sound? Okay, so as Reagan mentioned, I'm Michelle Bradley and I'm with Sun Health, and my day-to-day role here is what's called a memory care navigator, and we'll talk about that a little bit more further in the presentation. But I wanted to share that my journey to working in the field of dementia was very unexpected. So for the last 29 years, I've worked with children and families in healthcare and social service settings. And about 20 years ago, my life changed when my father was diagnosed with Alzheimer's. And then when he passed away about 10 years later, my mother was diagnosed. And so I've been living this journey personally with both parents for 20 years now. And when the opportunity became available to sort of shift my focus to helping other families navigate this really challenging diagnoses, I really jumped at the chance. And I've only been here for about 7 months, but I've worked with so many families already and just enjoy the work immensely. So what I'm sharing will be in part the work that I do, and then also my own personal experience. This quote at the beginning I always like to share, and it goes along with what Courtney was saying about how that emotional area of functioning remains. And so they may lose their ability to think through things and to rationalize and control impulses and all of that, but they still absolutely have feelings. I was doing a group before this, and there was a woman in there who shared that her mother was playing Uno cards with the family and had forgotten how to play Uno. Didn't remember what the colors were, the numbers, the rules of the game. But there was a moment in the game where the 6-year-old grandchild scooted up next to her and said, "Hey, Grandma, we can be on the same team together and I'll help you." The next day, the grandmother did not remember anything except how sweet that granddaughter was to her last night. So again, that's such a great example of that emotional impact and how that resonates and really lasts. The impact of dementia. I describe dementia as really a family disease. There's an individual who's diagnosed, in some families it's more than one, but it impacts everybody in the family. So we're going to talk a little bit about what some of the challenges are that care partners face. And care partners is used interchangeably with the word caregiver, so that it means the same thing, but it's whomever is really primarily responsible for providing care and meeting the needs of their loved one. It's sometimes a spouse, an adult child, can be a grandchild, a wide variety of care partners. But these are some of the daily challenges that they face. Most of us aren't equipped to really meet medical needs for our loved ones. And so taking care of their hygiene, meals, medications, tracking medical appointments, that's a whole new ball game for many, many care partners. Dealing with moods and behavioral changes. Often the person living with dementia, well, they do have their ups and downs, but sometimes there can be personality changes as well. And for some types of dementia, that can include some aggression. and some unpleasant reactions to family members. I'm working with 2 adult sisters right now, and their mother has decided that one of them is stealing from her and has really shunned her and pushed her aside and won't have anything to do with her, even though it isn't real. So there's some delusions happening, but her belief, like Courtney was saying, you can't argue with her because to her it's absolutely real. But imagine the impact on the one sister that's being shut out. Safety concerns. Wandering is a big concern. Safety with the stove. They may try to cook and leave it on. And so that can be a really tricky thing. And often it's wandering that ends up being the thing that results in somebody being moved into assisted living or memory care because safety is such an issue, especially here in Phoenix, the Phoenix area where it can be so hot. Balancing caregiving responsibilities with personal needs and obligations. So often a care partner has a full life to begin with, and then they have a loved one that they're needing to provide this care for. Financially, it's stressful, and mental health. It can take its toll on mental health for sure, and we'll talk about that a little more. The emotional toll for the care partner, it's just overwhelming, and it's not a linear trajectory. And so with dementia, it doesn't just follow these certain stages and look the same for everybody. It's very much a roller coaster. When people ask me, well, when will they stop remembering who I am? It's not like a light switch goes off and one day they stop remembering who you are. There may be moments they don't remember who you are, and then days they do remember who you are. So it's very much a roller coaster as the disease progresses, and those changes can be really complicated and difficult. Ambiguous loss and grief. This is a phrase that was coined to represent that slow loss we have of our loved one. So, for example, my mother, who's still alive, she's in memory care, and physically she's still very much alive. But I began losing her 10 years ago as the mom that she was gradually kind of disappeared to the point where her personality isn't there anymore. Her communication is impacted, everything is impacted, but I can look at her and go, there she is. So that ambiguous loss is really a key part of families, the journey for families with this illness. The guilt, the shoulds, I hear that so often. I shouldn't have snapped at them when they did that. I shouldn't get frustrated. I should be able to be nurturing. I should be able to avoid arguments with them. But people are human. And when we're stressed out, there are things that we do. And so I really work with people on giving yourself grace in these situations to be human. Conflict between family members. We see this often where one sibling will think their parent is ready for memory care and the other one will say, absolutely not. They're not ready. Why are you trying to place mom in a memory care community? So that can cause a lot of stress. There's a lot of adult children that tend to think they know what's best for mom or dad, even though it is their other parent who's with them day in and day out. And so we hear the voices from New Jersey and from Washington and Oregon, adult children who aren't living with the person with dementia, but they tend to chime in and feel like they know what's best. And so often I work with families to coordinate, to arrange a trip that's more than just a few days, so that the adult children can really see and experience what day-to-day life with somebody with dementia is like, so that when they're giving their opinion and their voice is being put into the conversation, they have a sense of what's really happening, and that can be so eye-opening. And the isolation. So as the person with dementia's world becomes smaller, the care partner's world becomes smaller. It's a lot harder for them to leave. They're not sure what's going to happen when they're not there. And often the person with dementia has a stronger need for them. So even people who are very independent, as their mind is fading, they turn toward their loved one to really be their guide and be their rock. And how easy is that for you to just walk out of the house and say, bye, I'm going to play tennis, when your loved one may feel lost and very anxious while you're not there. The financial strain. This is a struggle for so many families. The cost of care is very expensive, whether it's in-home care, whether it's in communities, it is exorbitant. There are many families that are in that middle area where they wouldn't qualify for Altex, which is the state public insurance system that can help fund some of that care, but they're not comfortable enough to be able to pay the thousands of dollars that are needed for care. So this is something that is such a challenge for so many families. And sometimes the loved one with dementia ends up in the home with inadequate care for much longer than would be ideal because they can't afford the options. Some of the loved ones and care partners, they reduce their work schedule or they stop working altogether so that they can provide that care. They take second jobs, reverse mortgages, do whatever is needed to try to cover the costs. Some families pool together resources. The isolation, I talked about that a little bit already, but there's also discomfort. There is still a stigma associated with dementia, and it can be embarrassing. That's just being really frank and honest, that when people have dementia, they often become unfiltered, less filtered. They say and do things that are more childlike and can be a source of embarrassment and discomfort for people in the community who don't know what's going on or don't care to know what's going on, and for the care partner. So that can be part of the isolation too. The high supervision needs, I mentioned those. And then some caregivers need to stop work. Work for many of us is a large part of our social worlds. Next slide. There we go. And we don't often talk about the impact that this has on marriage or romantic partnerships. Imagine being married to somebody for 50, 60 years and your loved one is regressing. And so they're becoming more and more childlike in their behaviors. Their memories have to do with things many, many years ago. For my mother, she would start talking about her mother like my mom was still a child. She would leave notes for her, letting her know where she was. Well, her mother had passed away years before. So my mother in her mind had become a child and was working from that frame of mind. Imagine the impact on that romantic partnership. It's really, really tough. There's a group that we started recently to work with partners, with marriage partners or those in long-term relationships around this very issue. Like, how do you stay connected when your loved one has dementia and they're sort of disappearing and regressing? How do you continue to fill their cup? How do you get your cup filled so that you can have a strong relationship all the way through? So most of these are self-explanatory. Becomes there's an imbalance is inevitably created where one partner ends up having to take on almost all of the duties that were usually split between the two. So there are a lot of partners that all of a sudden they're having to do taxes and they had no idea how to do that, or they're doing finances, or they're cleaning the house and that wasn't something they did, and cooking meals. There's a lot of shifts that happen. And after many years together, those shifts are hard. They're not easy to learn those new skills and change your roles in a family. And then there's also some studies that show that the spouses of individuals with dementia are at higher risk of dementia and earlier death. Some of that can be the caregiving and the stress. We don't know exactly what causes that, but some studies have shown that. Care partners and family, self-care gets neglected. And it's really, I just want to say, it's really easy for any of us to tell somebody taking care of someone with dementia, oh, you have to take care of yourself. You have to put your mask on first. But unless you're living it and you know how much that person depends on you and you feel an immense love and responsibility for that person, you don't know how hard that is. It's excruciatingly difficult to go get your nails done like you used to go to the grocery store. Either that person with dementia wants to come with you, and that can be a really challenging trip to the grocery store, or they don't want you to go because they'll be worried and anxious, or you're worried that they're going to wander and get into some things that they shouldn't get into. So that self-care, it really does, this wreaks havoc on self-care, and it's much easier said than done to think I need to take care of myself. And so we really need to continue to encourage that, but recognize why it's not happening. There's a lot of reasons why, and we need to be able to hear that and support that. The health risks for care partners. So there was a study, it was quite a few years ago now, that showed that care partners of people with dementia have a higher risk of death from stress-related illnesses. The percentage then was something like 67%, which was really jarring and kind of sort of sent shockwaves. The number's controversial, but more recent studies have shown around 30 to 40% increased risk, which is still extremely significant. And I see that with the families I'm working with, that so often they're both older, they both have health issues, but where does the focus go when one person is living with dementia? It goes on their care. There's a couple right now where he's finally at the point, with the support of his daughters, that his wife is going to be moving to memory care, and then his daughters want to shift their attention to him because his health care has been neglected and he's got some pretty significant medical problems. And they were worried that he would go before their mom. That's part of the reason for deciding to move her, so that he can have a quality of life now and get the care that he needs. So these are some of the impacts that it can have. What we also don't talk about, in addition to the impact on couples, is how does this affect people living with dementia? This is a tough thing to deal with. In the couples group that I'm doing, there was a spouse who was sharing how hard it is for him to take on all of this added responsibility. And I could see his wife next to me, who has dementia, start to well up with tears. And so then I brought into the conversation, and I looked at her and I said, how is this for you? Not being able to do those things anymore and seeing your husband take on all this responsibility. And she said, it's so hard. And so I said, it's hard for both of you in very different ways, but this is hard for everybody. So really supporting the person living with dementia, and everybody's dementia journey is different. Some people have what's called anosognosia, where they truly do not know that they have it. That part of the brain that's capable of self-awareness is damaged and isn't functioning properly. So when they say, nothing is wrong with me, why is everybody saying something is wrong with me? What we often think of as denial is not. It is anosognosia, and they are not capable of having that awareness to recognize what's going on with them. Now, there are different personalities, and there may be some people who do dig their heels in and are a little more, resistant to it, and it isn't that. But for the most part, it is that, and we should sort of assume that maybe they aren't able to have that awareness. I was sharing that people with dementia are so different. For my mother, she was an extrovert to begin with and continued to be very outgoing and very social through the course of her disease. For my father, he was introverted. He was a scientist. He was very book smart. And for him, he turned inward and he became very depressed. And so he needed to have that treated as well. It was devastating to him. When he got the diagnosis, he was aware of what was going on. And it was incredibly painful to watch. So they're such an amazing example of the different ways that this can impact somebody with dementia, where one can remain just happy-go-lucky and seemingly kind of oblivious to what's going on, which can be not a bad thing, and the other can just shut down and become depressed and disengaged from everybody because of how they feel about the diagnosis and the disease. The importance of support, self-care, and education. So kind of what can we do as community members, as loved ones, as family members of people who are living with dementia? I like the saying, when we know better, we do better. And Mary Beth Gallagher is the director of dementia services at Hospice of the Valley, and she uses this quote. And so I've latched onto it because it reminds me of how far we've come now from where we were with dementia care years ago. My mother worked in what were called nursing homes when I was a child, and a lot of the residents had dementia, and many of them were horrible places. They were demoralizing. They were dirty. They smelled bad. There were people moaning. They were really awful, and nobody knew how to actually treat these residents with the respect that they deserved and recognize them as individuals. And we've come such a long way. And even in the 20 years since my parents have struggled with dementia, we've come a long way. And I look back and I think, oh, if I only knew then what I know now, how differently would I have responded to my father through his disease, and how differently would I have responded to my mother in the early stages of her disease. But you know what you know, and we just need to keep learning, and we'll keep, as a society, we're going to keep progressing and learning more and more about how to better serve this population. Remembering that we can't fill anybody else's cup if ours is empty. For care partners, I talk about how it's reciprocal in a relationship, and then eventually it becomes very one-sided. And to prepare for that, they need to start building those external support systems so that there are other sources and people filling their cup so they can continue to fill their cup of their loved one. And then taking advantage of all the education and support programs in the West Valley and Phoenix. We are so lucky here to have so many incredible resources that we'll touch on, but learn, just keep learning as you go along, and it will just benefit you so much when you do need to interact with people who have dementia or support people with the disease. Doing time. Risks and prevention. I'm going to move through these quickly, but and this is always changing. A Lancet journal publishes something, I think it's once a year, that lists the identified risk factors for dementia. And there is research that shows that many cases are potentially preventable. This is an area that is ever changing. So at one point you may hear a glass of red wine is actually helpful, and then you may hear no alcohol has been found to be helpful with dementia prevention. So it's really a work in progress. But these are some of the things that across the board have been pretty consistent. So risk factors: smoking, inactivity, poor diet, diabetes, lower levels of education, head injury, alcohol use, high blood pressure, high cholesterol, obesity, hearing loss, vision loss, depression, infrequent social contact, and air pollution is the current list. Some steps to take to really mediate those risk factors: making sure you're moving. Whether it's cardio, strength training, those are the two that are often recommended, but even walking, even getting outside and walking down the hallway to get your cup of coffee, parking further away. So you walk from your car to your office or to the store. That's exercise. So there are little changes that can be very effective. Eating healthy. In general, the diet, there's no one diet for dementia prevention, but all of the ones that are recommended are some variation of Mediterranean style eating. And that typically is heavy on fruits, veggies, nuts, whole grains, extra virgin olive oil, and fish. And there's plenty of information out there on the internet. You'll be overwhelmed when you do a search for this. Knowing the risks. So as I was mentioning, alcohol now, there was a study a couple of weeks ago that came out saying, no, there's no safe level of alcohol. It is damaging for the brain. So we encourage people not to drink alcohol to prevent, as a form of prevention. Cigarette smokers, there's big risks there. 30% more likely to develop dementia and 40% more likely to develop Alzheimer's disease. Now, I will share, just because it's interesting, there's some studies being done right now on the impact of nicotine patches, possibly being something that can help reduce the risk. So it makes you look at, okay, it must be the smoke that's the issue with smoking, but maybe not the nicotine patches. So that's something that has shown some promise, and they're studying it further. But I just found it interesting. I also read a study yesterday about the impact of listening to music continuously after the age of 70, and the profound impact that can have on the development of dementia. I believe it reduces the rate by about 38%. And so that study was specific to 70 and older, but I can't imagine it wouldn't have a really positive effect on those that are younger than 70 as well. It certainly won't hurt. And that's true with a lot of these things. Sleeping well and managing stress, aiming for 7 to 8 hours a night, doing breathing exercises, music, yoga, mindfulness. Everybody has a different way of relaxing, but making sure that you're taking some time to really wind down. Staying connected and mentally stimulated, interacting with others, socialization is so important. Learning new things, just keep learning, keep the brain active and stimulated. Challenging your brain, there are some apps that you can put on your phone. And Dr. Ho from Cleo Roberts did a presentation recently. And I don't remember the name of the apps that he shared, but he was talking about some apps that actually have been studied and shown to be very effective with keeping the brain functioning at a high level. Engaging in hobbies. Keep doing the things you love. Take on new hobbies. Staying as active as possible in the world and as engaged as possible in the world. I want to highlight treating hearing and vision. Hearing was just added to the list in the Lancet Journal, I think in the last couple of years. And this is something that really, the doctors are out there really pounding the pavement, trying to get the word out about this. Think about how many older adults, or not even older adults, have hearing loss but don't want to wear hearing aids, or have hearing aids and just set them aside because they're a little bit of a hassle sometimes, or they just don't want to wear them. But they really are showing a connection now between hearing loss and dementia. And so it is strongly recommended that if there's any concerns about hearing loss, no matter what age you are, that you get your hearing checked. And there are places that will do free hearing checks. And if they do find that there's hearing loss, we recommend hearing aids, that you get hearing aids. That is a way to stay engaged with the world. It keeps that part of the brain functioning. Think about how much you might be, it's hard to know how much you might be missing if you're not hearing what's going on around you. And vision is similar in its effect. Just taking care of your overall health, physical health, mental health. As you saw in the list of risk factors, a number of those things were health issues. Mental health was on there, depression, also cardio issues and cholesterol and diabetes and obesity. So making sure you're taking care of your overall mental and physical well-being. And if your loved one experiences memory issues, there are resources and supports. And that's what I'll go into next. How am I doing for time, Reagan?
We're on track. You have about 3 minutes left, and
okay.
Yeah,
all right.
We're getting close.
Talking quickly. Okay, so I divided this presentation up into nonprofit dementia resources that are in the West Valley, and then those that aren't located in the West Valley, but certainly serve families and provide support for families in the West Valley. And I'm just highlighting nonprofits here. There are so many for-profit businesses out there. The list would probably be, 10 pages worth of resources, and I don't want to handpick certain ones. So we're going to focus on those of us that are in the nonprofit industry and work really closely with each other. So there's a lot of cross referrals and communication and collaboration that happens. And we will start with Courtney's agency. Benevilla is one of the nonprofits here in the West Valley, and they have those amazing adult day life enrichment programs. I recommend those to so many of the families that I'm working with. It's a respite for the caregiver, but it also is really good for the person living with dementia because of the stimulation, the safety in the environment. They do painting, and there's an intergenerational component at one of them that is just remarkable. So these are programs that are really important to know about, and they're broken down by the stages of dementia too. So that it's not just a one size fits all. They really assess where is this person at and which program will be the best fit. They have dementia caregiver support groups, and they have a much broader range of support groups too. And then they have the CARES program, Community Assistance, Resources, Education, and Support, which has a number of preferred partners in the community that they refer out to and recommend. And I can give an example that just a few days ago, I got an email from CARES saying, hey, we just referred a family to you and gave your contact information to them. Here's their name. If they reach out to you, that's a referral from us. So they really look holistically at what are the resources needed for these families. And if they have anything to do with dementia or potential dementia or memory loss, then I may be one of the referral sources. But there are so many others in the communities, financial, legal, et cetera, that CARES has connections with and provides referrals to. And we have Sun Health, which is the organization that I work for. We're probably best known for the life plan communities. There's 4 really large senior living communities that have assisted living, or have independent living, assisted living, memory care, and some have skilled nursing. What we're less known for, which is the program I'm a part of, is the Center for Health and Wellbeing. And we are funded by the philanthropic branch of Sun Health, called the Sun Health Foundation. And we provide community education and outreach, fitness classes. They're very low cost. I believe they're $5 per class, nutrition services, and then my role, memory care navigation. And my role in a nutshell is it's a free service that's funded by the foundation. So I work with a lot of families in different financial circumstances, and I go out and I meet with them in their homes. If they don't want to do that, we can meet here. Sometimes we meet it for coffee or restaurants, wherever the family wants to meet. Some people feel uncomfortable with a home visit, or their loved one with dementia who's living there might feel uncomfortable with those types of conversations. And so I offer different options for having that meeting. It's support for all family members. A lot of conversations happen with adult children or grandchildren or other people involved in care. Nothing makes me happier than going on a home visit. And I had one a couple weeks ago where there was the spouse, there were her 2 adult children and her granddaughter. We're all there for the meeting to learn more about dementia and how it was impacting the father and grandfather, and to really talk about what was going on. That's just a beautiful thing. Like I said, it's absolutely a family disease. And so the more people who are involved that we can educate and support, the better. We have the memory cafes, which are phenomenal. And the way it's been set up, and these are put on by or overseen by Dementia Friends Arizona, which connects to the program Courtney was representing and sharing about just a few minutes ago. But we now have them across the West Valley at 5 different locations. And what's beautiful about it is they're all scheduled on Tuesdays, and they're different Tuesdays so that people with their caregivers can go to one that they like that's in their neighborhood, or they can make the rounds and go to all of them. I was at the Goodyear one this week, and there were 4 families that came in that I had just seen at the surprise one the week before. So it's really cool, and it's free, and there's snacks and food, and there's a life enrichment activity, and then there's caregiver support session that happens separately toward the end. They're amazing. There's a new nonprofit in the area, newish, called I'm an Alzheimer, and it's run by a woman named Sharon Muschiali, who is, oh my gosh, she is just remarkable in her advocacy and her voice. She has Alzheimer's herself, and she's considered a high functioning with her Alzheimer's. And so she and her husband have created this organization to support other people who have high functioning dementia. And she's out there. She was speaking at the Alzheimer's Association walk that just happened. She was one of their keynote speakers. She is so passionate about this cause and such a great voice for others living with dementia. She offers support groups. She has something called Crafternoons for people with dementia that is just such a beautiful event. And she has sometimes up to 18 people who come to their community center and take part in this craft. It's all geared toward people with dementia. They do homemade meal delivery to people with dementia that maybe are coming out of the hospital or need a little extra support for a time period. And she's a huge advocate about shifting away from people with dementia driving. She can be a great voice for that with people. She talks to them. She provides information on other resources for transportation in the community. She has a grant that covers the cost of a driving assessment for people with dementia. So her organization is amazing. I can't say enough about them. Banner Health, we have in the West Valley, Banner Sun Health Research Institute. So many of the families that we work with, I'm sure Courtney as well, go here for their diagnoses and for their care and treatment. And they also have research studies that people who are eligible can take part in. They have this wonderful program, the free brain health check-in, for families that aren't ready to jump to seeing a neurologist. Often this is a nice, gentle starting point. It's a free 45-ish minute brain health check. And if there are concerns, the team at Banner Health will guide them to those next steps. Sometimes if there's a couple where one is concerned about the spouse and the spouse isn't there yet, I recommend they both go do it together. so that the person who's maybe experiencing some memory changes doesn't feel targeted. And that's worked really well for some of the couples that we're working with. And then in the West Valley, serving the greater West Valley, Banner Alzheimer's Institute, Barrow Neurological Institute. Barrow has one of the most amazing comprehensive guides for dementia. If you look up Barrow Neurological Institute Dementia Guide, it is a booklet that's many, many pages, but you can download it for free. It's a great resource. It sort of covers everything you would want to know about dementia. It has a section on the stages of Alzheimer's that I share with clients that I'm working with often when they ask about that. That's a great free resource. Hospice of the Valley is another organization that serves the entire area, but they have an amazing wealth of programs. They have a supportive care for dementia program. They have their hospice care, which is what people think of when they think of Hospice of the Valley. They have a whole campus devoted to dementia care and education, and they do a lot of community classes and support groups. I can't tell you how many times I say to families, I'm going to recommend an organization to you, and I don't want you to get scared when you hear the name of the organization because it's so much more than that. And then I say Hospice of the Valley, and they tend to go, because to most of us, that means end of life care. And so I always preface it by saying, don't panic. There's a lot more to explore here. And the Alzheimer's Association, they have support groups, education, resources, advocacy events. They have something called Alz Navigator, which you can go online and type in your information. It can give you some resources in the area and help you plan. And they have this hotline, which is amazing. I give this to all the families I work with just in case. I said, you can never plan for an emergency. And so having this number, even if the emergency is you just need to vent because you're falling apart, you can call them 24/7. And then they have something called Alls Connected, which is online peer support. Duet is another organization. It serves a much broader population, but they do have some programs specific to dementia. They have one in particular that I find interesting called Finding Meaning and Hope discussion series. And it's based on one of my favorite books called Loving Someone Who Has Dementia. That is a great book for anybody sort of looking for information on how to support a loved one. And that is a wrap. Thank you for sitting through this and listening to all of this information. It was a lot from both Courtney and I, but now I think we're opening it up to questions.
Yes, thank you so much, Michelle. And I'm just gonna hit end on the record button and just say thank you so much for all of that wonderful information. And we're really excited to share that with everybody here.